Welcome to the Health Tech Heroes, where we talk to innovators who are rewriting the DNA of healthcare. Today, we are joined by Steven Pickett, Chairman, CEO, and co-founder of Tabia Health. Steven's story spans decades of leadership across digital health, cybersecurity, and ICT. And he is now on a mission to transform chronic disease care with Tabia's AI-powered platform. His journey is fueled by passion for solving complex challenges and building teams and change lives. Steven is also deeply involved as a board member of several cutting-edge technology organizations in innovation and strategy across digital landscape. Steven, thank you for joining us today.
Fasa, first of all, thank you for the very generous introduction, and I'm thrilled to be here and appreciate the time, both your time and the time of the audience members as well.
And I truly appreciate you being here. And with that, your first question, Steve. Can you share a pivotal moment in your career, a personal story or challenge that shaped your passion for transforming healthcare and drove you to focus on innovation?
Yeah, Fasa, and I'll share that this is something that inspired not just me, but the entire founding team at Tabia. And I think the foundation, and I suspect this is true of most of your listeners and likely you as well, and that is that when we've had experiences, either personally or with loved ones, with the medical system, we periodically find that there's not the level of precision in terms of execution that we'd like to have, particularly when, a problem might be a more serious problem. And so that was on our minds as a founding team. And then we came upon a quote from the World Health Organization that really was the eureka moment for us in terms of what we wanted to do to try to improve human health worldwide. And I'm not going to get this quote perfectly right, but generally the idea of the quote is that the single most impactful way to improve human health worldwide isn't necessarily the discovery of a new drug or a new treatment plan. It's just getting people to better adhere to the scientifically validated treatment plans that we already know about. And I think there are likely a lot of people in the healthcare industry who would nod their head and say, yeah, that's a problem, but maybe haven't really thought about what technology can do to improve the situation. And, I think it's important to acknowledge that it'll never be perfect. There are too many moving parts and, there are various levels of motivation. But at the end of the day, the proper use of technology can improve the situation profoundly, result in much better health outcomes for patients. And frankly, that can also deliver some very important and material economic returns for the healthcare providers themselves. So that was really the inspiration for the company. Our tagline from the very beginning was Adherence Reinvented, and really that's what it's about. It's taking the process of managing patients from one that is largely manual today to one that's purely digitally driven, which essentially helps eradicate errors and missed steps through a treatment journey.
That's so profound. And that quote from WHO, that having the treatments available and typically are probably going to be a lot more cheaper than the innovations that are coming tomorrow. And if we can just apply this properly, I think we can have a much better outcome. And for you personally, Steven, was there something in your life before even Tabia that happened that kind of drives you, right? So we can get into something because of inspiration, but to keep going and going, there has to be some other driving factor that makes you do what you do day after day after day. And what would be that driving factor for you?
Yeah, I would say, very early on, and this was an experience I had after my first daughter was born. Unfortunately, there were a number of complications after her birth, and she spent 10 days in the NICU. And although there were just wonderful people providing care, what I observed is that lack of precision and execution that I spoke about just a moment ago. Situations where if our daughter hadn't had the right advocates in the room, her mother and me, I'm convinced there would have been treatment steps that would have been missed. There could have been delays in terms of getting the treatment that she needed as a newborn. And I don't think we should have to rely on those advocates to drive precision in the process when there are so many well-meaning people who are delivering the care who could just be, better supported through the use of digital technologies. So I'd say that's really been a driving motivation for me, is making sure that everyone has the opportunity to have that level of precision in care to get the best possible medical outcomes.
So in a way, I feel you being mom and dad to this little child, being an advocate, you have just scaled that advocacy to for more patients with Tabia.
Plus, that's such a great way of describing it. You're right. I mean, it shouldn't be about individual efforts, right? There needs to be a way to deliver that precision and execution at scale. And, when you digitize these processes, you have an opportunity to really deliver excellence in terms of execution at scale and with real, equality as well.
Turning back the focus a little bit on yourself, Stephen, you have led and built teams in some of the technology's most demanding sectors. Was there any particular setback or fork in the road that tested your resolve and inspired your current mission at Tabia Health? This is more on the professional side type of question.
Boy, lots of them in a phrase, lots of them. And, fortunately, I work with an incredible team of professionals. So that team and myself, I think, come at these problems with a focus on how do we work through them, right? How do we stay focused on the mission and, recognize there are going to be challenges along the way, but you've just got to have the, personal determination and fortitude to make sure you find ways to overcome the challenges or to move around the challenges if that's what's required. But I would share, as a founding team, we have lots of scars from the journeys that we've had, not just with Tabia, but with business experiences before that as well.
Any specific scar you want to say and how you resolved it? I'm coming from a perspective of a student who's excited to learn. If there is a scar and a solution for it, it'll be amazing.
I'd say one that comes to mind is one that is not healthcare related. Earlier in my career, right after the tech bubble burst in the year 2000, and yes, I have enough gray hair that I remember that quite well. I was involved with the business. I was running a business that had an addressable market that had gone from a $25 billion addressable market, and in 18 months later was about a $2.5 billion addressable market. The market of 90% of the market just evaporated over time. As a team, we rallied together and asked ourselves, what are we going to do differently? Because we can't change what that market situation is. And so we came up with a plan that allowed us to pivot the product portfolio so that it could serve other markets, and we were able to get the business back to growth mode in spite of the challenges that existed in the macro market at the time.
So basically adapt and pivot and look for new markets might be a solution for something if dramatic loss of 90% of addressable market disappearing. And from your perspective, this is a personal view. Healthcare is a deeply personal for so many. Can you tell us about a time when the real world impact of your work, perhaps seeing a patient or a provider's life changed, reminded you why this journey matters for you?
Yeah, there's a number of them, but there's one in particular that really stands out, and this happens to be an experience with a very early customer at Tabia. And with this particular customer, we were able to reach agreement with them that we would do some data analytics before we implemented the Tabia Health solution. And that data analytics included looking at the treatments that they had delivered historically to their patients and essentially assess how frequently those treatments were delivered on time. It's a very well-regarded healthcare provider. And so what we were able to do is we were able to identify what the ideal treatment date should have been for all of the treatments that were delivered. Now, of course, this means we couldn't assess treatments that were missed, right? But just the treatments that were delivered. And we and this healthcare provider agreed that we were going to wrap a 1-month window around that date. And if the treatment was delivered within that 1-month window, that would be counted as on time. And after the data analysis was done, what we and they found, a surprise to them and a surprise to us, is that only 12% of the treatments that were delivered on time based on that definition of falling within the 1-month period. And I'll share with you that I still have yet to find a single healthcare provider who can tell you what that number is. I'm also happy to report in terms of good outcomes. About 6 months later, this particular customer presented at a conference what their prior month's on-time treatment rate was. And that number was 62%. So roughly about a 5-fold increase in adherence. And frankly, that really gets to the heart of the mission of this company, which is how do you drive better adherence? Because we all know that driving better adherence to treatment plans delivers better health outcomes. Now, again, what we didn't know up front is what that could mean in terms of economic gain for the healthcare providers themselves. And we're also finding, and in this case, we absolutely found that there was a material improvement in economic performance that was just a bonus. Right, essentially a side effect, to use that term in maybe a bit of an unusual way in healthcare. It's really satisfying that we had the real world data that said we're really making a difference here in terms of managing treatment plans in a digital way and in getting real world evidence that can improve adherence and therefore improve medical outcomes.
First of all, kudos to you for creating this platform, and kudos to the physician or the key opinion leader for the humility of saying that, yes, I am not meeting my own metric. It takes a lot of humility from a person who has already achieved so much and been so successful. So kudos.
Their willingness to shine a flashlight on this problem that really isn't unique to them, right? It really is an industry problem. But again, there's ways to improve that situation through the use of technology. And, heretofore, I don't think the technology was robust enough to really be able to solve the problem. But with the rapid advances that we've seen, particularly in AI at this point, there are material ways to address that underlying problem.
And the second thing that struck to me is the outcomes are better because of early delivery and efficient delivery, but also there is an economic gain to it. So we are bringing it the whole circle. It is not just that, hey, patients are doing well, but that way I can see all the stakeholders like, hey, let's do this. There is no stakeholder, including the payer, not left behind.
My view on it is that I don't think you have a health tech business if it doesn't start with driving better patient outcomes. But the reality is we live in a world right now where healthcare providers are also struggling to just break even. And so if while we're delivering better health outcome, can deliver materially better economic outcomes for the healthcare provider, it means they can provide care to more people. And so it really does create an important flywheel effect. Right? If you can help drive improvements in health outcomes, drive better economics, right, you begin to be able to care for more and more people in an optimum way, and hopefully health overall and across very large populations can get better.
That's awesome. Now, spotlight on Tabia itself. Tabia is described as an AI-powered care management platform improving patient adherence across multiple health conditions. For listeners new to the space, how does Tabia platform actually transform chronic disease management, and what makes it different than any other platform that is out there? And also, I would love your take on the name Tabia itself, because we spoke about this before the podcast, but I would love to have it recorded as well.
Yeah, so maybe I'll start with that. So Tabia in Swahili means behavior. And what we're really trying to do is change behavior, not just patient behavior, but behavior of the entire ecosystem. It also means essence in Arabic. And so those were the two kind of aha moments that caused us to say, hey, that really feels like the right name for the company. And I'll share with you, we built the company from day one to be a global company. Our focus is first on the U.S. market, but we have now achieved market penetration outside the U.S. as well. And so we really thought a lot about what was a brand that that made sense internationally as well. The other thing, maybe before I describe what we do at Tabia and what's unique about what we do in Tabia, is to just highlight that indeed we run on an AI engine. I don't think that's important. It's just an enabling technology. At the end of the day, what's important is what are the problems that you're solving. And so when we engage with customers, that's really where we start, is let's talk about the problems in the system or the suboptimum parts of the system and what we can do to drive improvement. AI it's an important buzzword or buzz letters, if that's the right way to describe it. But at the end of the day, it doesn't matter, right? It's about how do you solve problems. In terms of what we do, what we've built at the core is what we call a care orchestration engine. So just think of it as a care management platform. And we built it in such a way that it can deliver real precision in care management. So how do we do that? And precision means unique steps for each and every patient depending on their particular situation. So in order for the engine to work, we need to ingest data. And so one of the first places where we ingest data is from the EHR, because we know that's the source of truth in terms of the history of the patient and the current situation with the patient. So we're going to ingest data from the EHR. We're essentially EHR agnostic, and think of us as a layer on top of the EHR that's managing the patient interaction. For those who might be familiar with ERP systems, I think something is emerging here in healthcare that may be analogous to what happened in the ERP world. ERPs are great systems in terms of financial management. If you have a manufacturing facility, they interface back to manufacturing to drive the manufacturing process. But the ERP vendors didn't necessarily have time to build the right interface for a sales organization, as an example. And as a result, an entire new category emerged called CRM, Customer Relationship Management, that laid on top of the ERPs. And of course, Salesforce made that real market at the end of the day. But that's now an entirely different category. And I think that's what we're seeing with EHRs, is they're doing such a fabulous job in terms of managing that critical data and managing the billing process. They really haven't had time to optimize what's being done in terms of managing the care journey. So there's an opportunity to lay a system on top of the EHRs that's EHR agnostic to do that. So we start by ingesting the data from the EHRs so we know about each and every patient. And then we go through the process of ingesting data from scientifically validated sources about a myriad of different conditions. And so as an example, we have a strategic relationship with the American Heart Association, and we're the first company to take both their educational content and their care plans and digitize them and put them onto the platform in order to help cardiologists use the power of the scientific analysis that's gone into building those plans on a digital platform. We also have care plans from the National Comprehensive Cancer Network, and from the American Academy of Ophthalmology, to name just a few. So not only are we agnostic to what the EHR is, we're agnostic to what the condition is. And we're often thought of as a company that has been built to manage patients with chronic diseases. And we do. But the reality is, if you can manage very complex situations, you can manage simple situations as well. And so we're a platform that's going to manage all patients, regardless of their conditions, and regardless of whether they have a single morbidity or they have comorbidities. Because if there are comorbidities, we're just going to blend multiple care plans into a specific plan for that particular patient and make sure they're moving through the process without missing a step. We'll speak, that means no care gaps, and making sure that those treatments are delivered in a timely fashion, or that there's at least some type of alarm bell that goes off if something is going to be missed, if there's some probability that something is going to be missed or something that's going to be delayed. And then the other data source that we bring in, and at this point, because the payer system is so complex in the U.S., I don't want to overstate this. At this point, what we do in terms of insurance is rather rudimentary, but we also bring across information about payer rules, and we also integrate those into the care plans for each and every patient. So as an example, if a patient needs to go through a procedure and they have health insurance company X, maybe there's a requirement for a prior authorization. We can trigger that, and we can make sure that that prior authorization is done before the appointment is scheduled, rather than trying to react to it if a mistake was made and that prior authorization hadn't been secured prior to the delivery of that particular treatment. And of course, if it wasn't, then there's going to be a battle that's going to ensue between the healthcare provider and the insurance company, and we want to try to help eradicate those kind of problems as well. So once we've brought that data into the engine, now the engine begins to work. It can identify what the next steps in the journey are and deliver those daily tasks to people who are responsible for getting those daily tasks scheduled. And so that might be a care coordinator or a nurse navigator or an administrator. So we can deliver those tasks to that work group. And of course, if we can deliver those tasks to that work group, we can also deliver those tasks to an AI agent, and we do. And from there, it's all about how do you then bring the patient into the process. And so in addition to building this care orchestration platform, we've also built what I would characterize as a next generation patient engagement platform that is very much focused on medicine. And these AI agents, by the way, can communicate to patients in the way that patients communicate with their friends and loved ones, meaning that we've made a conscious decision not to build an app. Because if anybody has the experiences I have, I don't remember what the app was called depending on which doctor I'm going to. And then I certainly don't remember what my username and password is. And so we think there's a lot of logic to just communicating the way we all communicate each and every day. And so it's a multimodal way of communicating. It can be WhatsApp internationally, that's commonly the choice. It can be texting. It can be a phone call that an AI agent makes as well. And then for those health care providers who do have a specialized app built, that's fine. We can also route those messages into the specialized app. But we wanted to make sure we had maximum flexibility in terms of how we engaged with the patient to improve their level of engagement in their own care. Now, by the way, because we're connected directly to the patient, it means not only can we do the mundane things like scheduling appointments, but also means we can deliver patient education to help them be more knowledgeable about the disease that they might have and more knowledgeable about lifestyle changes that they might want to make in order to best manage that disease as well. And then the final thing I'll point out as it relates to the patient engagement piece is that we're also able to communicate to the patient in whatever language they would prefer to communicate in. And what we find is when you communicate with someone in their preferred first language, their level of engagement goes up. And of course, that's possible because we're using AI agents first and foremost. But even when the task isn't appropriate for an AI agent to execute, it's more appropriate for a person to do that. Because the person is using our platform to communicate with the patient, we can make them multilingual as well. So if they know that that particular patient wants to speak arbitrarily in Polish or in Portuguese, fine, right? We can make that real-time translation bi-directional and create a much better communication between patient and the healthcare provider itself. So what's unique about what we do, number one, is that we're purely agnostic to what the condition is that needs to be managed. We're not the experts on what the treatment plans need to be, so we work with those who are in order to bring that knowledge base to the platform and to anybody who wants to use it. And number three, we're a platform that works for all your patients, not just a subset of your patients. So I'd say those are the things that are really unique about what we're delivering today. And if I go back to AI for just a moment, to digress back to AI, what we're often seeing in the market is that there are a number of AI solutions that tend to be kind of individual point solutions. And it's at least my belief and the belief of the founding team that the right way to use AI is to build a platform that solves an entire business problem across an enterprise. So you're not just deploying AI in a number of different silos, right? You're really solving a comprehensive business problem with a single platform that's got the flexibility and versatility to be able to care for all of your needs in that particular area of the business.
I have few questions, follow-up questions based on this, if you're okay with that. So each thing is going to be unique to each patient. So you're not trying to fit a square peg in a circle type of thing. So every patient has their unique journey. So it is possible now. The second one is you are above the platform. What that means is for the patient, if they move to a different payer and an employer, so their data can be easily taken from here and plugged into the other person's other system's data if you are partnered with that system as well. Is that a almost seamless transition?
If we're partnered with both, then yes. If we're partnered with just one, then unfortunately there's a barrier, right? This happen. But if it's used in multiple facilities, then yes, we should be able to cross the chasm, if you will. I'll also point out that in healthcare, we're seeing an awful lot of roll-up strategies being executed right now. Different specialty care practices being consolidated by private equity in some cases. And when that happens, it's not uncommon for there to be multiple EHRs EHRs in a single business. And so because we've taken this approach to be agnostic to who the EHR is, it also means that you can have this common business process managed by Tabia, regardless of who the underlying EHR is. And so it really helps facilitate some of the scaling of these businesses as they're being rolled up.
And the third thing was exactly this. From a business perspective, you have a moat for yourself that even if individual EHRs provide a similar service, if they come up and using their large platform and influence, come up with a similar solution, they cannot cross talk, but you can. And so there is a huge...
That's such an important point. So thank you for making it. And I'll also describe that, our experience with EHRs is such, right, the heart of what happens in terms of healthcare. But depending on the EHR, they have different levels of capabilities when it comes to this patient management process. And I'll also describe that one of the other driving forces for us is the concept of if you don't know where you're going, any path will do. And so, sometimes we see EHRs or even standalone companies who are just focused on patient engagement, as an example. And we think the patient engagement process needs to be informed by what the treatment journey is. And so we think bringing those together is of utmost importance. So I think that's another differentiator in terms of what we're doing. Something else I should probably share for the benefit of the audience is that when we build these care plans that come from scientifically validated sources, they're not so rigid that they can't be changed, because we know healthcare is still as much art as it is science. And so you have doctors who might say, hey, I want to use as a foundation this care plan from arbitrarily the American Heart Association. But for this particular patient, I want to add these 2 steps, and I want to take away this one. And we built the platform in a way that's called a no-code way that allows them to, on the fly, make those changes. Indeed, you're adding, right, a whole nother level of precision medicine for each of those patients, depending on their specific situation. Because what we don't want to do is essentially play doctor, right? We want the doctor to still have the flexibility to say, hey, here's something unique, and we don't want to just follow what the textbook says we should follow from a care plan point of view. So we're very careful to make sure we maintained flexibility in the system to make those real-time adjustments to the treatment plans.
So this is also personalized to the physician. So if there are 10 patients coming to this physician, they will have a physician personalized care plan. And in the same system, another physician will have possibly a different care plan, similar patients. Is that how it works? So it is not just for patients, but also at a physician level personalized.
Faza, right on. Yeah. And by the way, for the administrator as well, right? Again, whether that be a care coordinator, a nurse navigator, or an administrator. And so really everybody involved in the use of the system has a fair amount of flexibility in terms of how they use it. Obviously, if there's a treatment plan change, that needs to be directed by a doctor. But yeah, lots of flexibility built into the underlying platform.
All right. This is fascinating. The next question is, what would you consider as a team, as Tabia? What would you consider as the first thing when I ask, like, what is the win for you? And also with so many successes, I'm sure there are challenges too. So what would be your win and the challenge?
I think, in terms of wins, I think the example I shared with you about having the real world data that shows that we're improving adherence rates is really, satisfying to the whole team, given that really is the mission. No doubt some of the challenges do include finding a way to integrate into these deeply embedded legacy systems. Right, that's not easy work. Unfortunately, we have a team that has a real competency in terms of how to do that. So I'd say that's one of the challenges, right? But you just got to find a way to overcome. And then the second part is there are many health systems who are so busy doing things the way they've always done them that it's hard for them to step away from the fray and say, hey, if I invest a little bit of time, here is what the promised land looks like, so to speak. And so sometimes getting people to just take a breath from what that daily intensity is of providing care to lots of patients in order to say, hey, here's a way that we can profoundly change how we manage care and have a better work-life balance for our professionals who are in the healthcare provider and deliver a better customer service experience and better patient outcomes from a health point of view to our patients. We need to take a pause and figure out how to make that happen. So I'd say those are probably the big challenges. integrating from a technical point of view into the legacy systems, number one. And number two, getting cycles with particularly executive management, helping them understand what kind of profound changes can come from implementing our technology or anybody else's, new technology that can deliver significant benefit.
Thank you very much. So, based on your experience with the AI and cybersecurity, where do you think the biggest opportunities or risks in healthcare innovation over the next 5 to 10 years? This is with the perspective of your audience are going to be new entrepreneurs and leaders who are coming into this fray and into this sector. Want to give them advice. Hey, these are the biggest opportunities in next 5 to 10 years. Focus on this because this is going to be a good business and also have the largest impact on patient lives.
Great question. The risks associated with security vulnerabilities are growing, and that growth isn't going to slow down or stop. It's going to continue to accelerate. What we're seeing are more and more different attack vectors, right? Different ways that that systems can be attacked. As it requires a real determination to allocate the right amount of funding to make sure that you've got the optimum security posture within the company. It also requires the right level of training for your staff, not just on HIPAA, right, which is table stakes at this point, but as it relates to how do you protect systems from possible cyber breaches. And so I think it's something all of us need to pay particular attention to and just be, vigilant about making sure you got the right systems and the right tools in place to guard against a problem. I'd say even in terms of HIPAA, we've made a conscious decision not just to be HIPAA compliant, but to also be third-party audited. And we're doing the same thing from a cybersecurity point of view, asking for outside experts to come in and really opine on what is best in class in terms of everything we do from a security point of view. And so that's security in terms of the risk of a system being attacked, but also security as it relates to protecting that personal information about patients as well.
And this is to do with more of a guidance for the mindset of an entrepreneur or leader who's getting into this field. As you said, we are going to have challenges where people push back. They do not want to change. And this change is like super dramatic. It's like everything, things that used to happen over 50 years is happening in 5 months or 6 months. That's how dramatic the changes are. What kind of the mindset an entrepreneur and leader has to come in so that you have the entire team champion for the same thing? What is that unique mindset that the leader has to keep in forefront, especially in times of change?
I think first of all, you really have to focus on the outcome, right? The vision. What does this look like after, right, you go through the transition period? And I think the second thing that's valuable to focus on is how do you improve the life, not just of the patient, but of the healthcare professional who is overworked at this point, bringing work at home, end up being home late because they have so much to do in a particular day, particularly for those who might be in the role of a nurse navigator or a care coordinator. I would assert that there's a fair amount of their time that is spent doing things that they really don't want to do, the mundane things, right, around scheduling appointments, etc. And what they really want to do is spend time empathetically engaging with patients and helping them work through the more complicated things and help them with understanding what's going to happen next, what lifestyle changes they need to make. And we can supplement that through the digital delivery of educational content, but it's never going to substitute the one-on-one human-to-human interaction. So I think as the workforce understands that we're going to give you time to do the most valuable things within your particular area of the healthcare ecosystem, hopefully there will be an appreciation for the fact that this is just another tool, right? Long ago, I used to do division longhand. And as a result, I made mistakes, maybe more than most. But now I don't make mistakes because I use Excel, right? That process has been digitized. And I'd ask them to think about these business processes in much the same way. We're merely delivering you new tools that are going to give you time to really dedicate to the things that you want to do and where you can make the biggest impact. I have had some doctors say to me, wow, once we get this deployed, I can actually imagine being able to make it home for dinner with my family. So it's all about what can you do to deliver tools that make everybody who's involved in that ecosystem better off, right? Whether it be work-life balance or whether it be better health outcomes or whether it be better economic performance. So keeping focused on the vision, right? What will it look like after we go through the implementation process?
That's fascinating because we think about complex outcomes, and sometimes it could be the outcome could be just that the doctor went and had dinner with their family, which they wouldn't have had without the system. And before we wrap up, Steven, you will have 90 seconds. You can take 4 minutes if you want to share anything we missed during these questions, or reiterate anything that you deem very important. So essentially, the question is yours, the answer is yours, and the stage is yours.
Thank you. Maybe I'll highlight one other capability in the platform that we haven't talked about. And that is the ability of the platform to keep track of how patients are doing in between doctor visits. And so the platform also has the ability to query patients, because we're in communication with patients about how they're doing. That can be important information for the healthcare provider to be aware of. That can be through simple surveys and questions. But we can also do things like managing an RPM. And for those who don't know, RPM stands for remote patient monitoring. So this, in the world of cardiology, might be a blood pressure sleeve. And today, things like RPMs can be prescribed by doctors, but they tend to only be used in the most acute cases because it's so labor intensive to get those things prescribed, right? You have to deal with the logistics of it. You have to educate the patient on why it was prescribed, how to use it, answer technical questions they might have as they're getting comfortable with it. And the reality is, a big chunk of that can be handled through AI agents. And so we can now imagine a future where those things that can keep track of how a patient is doing in between visits can be better understood by the healthcare system because it's being managed digitally and it's being managed through AI agents. So I'd say that's one other thing that I think it's important in terms of the long-term vision of how healthcare can improve. Hopefully we can make it more and more real-time, right? The awareness of what's happening with a patient to become more and more real-time through management of things like RPMs. And I'd say finally, I just want to say thank you again for having me on today. I greatly appreciate it. And thanks for those of you who tuned in for sharing your time as well. And if you want to learn more about Tabia, tabiahealth.com is one of the places you can go.
With that, thank you very much, Steven. I truly appreciate your time and your advice and the wisdom that you have shared today.